Hey everyone, and thanks for tuning into this week's wellness webinar. This week we're going to shift gears a little bit and talk more about a big picture health issue, and that is heart health. Oftentimes when people refer to heart health, they're actually referring to what is called the cardiovascular system. The cardiovascular system is made up of the heart, which pumps the blood, and the blood vessels, which move the blood around the body. And the blood carries oxygen, signaling factors, nutrients, all sorts of materials all throughout the body, and so it's really important that it continues to flow. That's why the health of our cardiovascular system is so important. And so it's important that we think about the impact of our biology and behaviors and what that means we should be doing to protect it. Heart disease is the leading cause of death among U.S. adults and is believed to be responsible for every 1 in 4 deaths. Heart disease encompasses a wide range of conditions that can affect the heart, including diseases that might affect the blood vessels, to problems with heart rhythm, even birth defects. More commonly, what people refer to as heart disease is also called cardiovascular disease, which refers specifically to narrowed or blocked blood vessels that can ultimately lead to cardiac events like chest pain, heart attack, or stroke. There are a lot of different forms of heart disease. A lot of them are listed here, but the most common one is coronary artery disease, which will be the focus of the rest of today's webinar. There are a lot of different factors that might impact the risk of developing heart disease. Some of them might be in our control, like lifestyle behaviors, or some of them might be out of our control, like the factors listed here. So genetics. Genetics can impact a variety of different facets of the cardiovascular system. So perhaps that's how we respond to certain lifestyle factors like diet, exercise, or stress. Or it could even just be impacting the baseline function of the heart and blood vessels like blood pressure and cholesterol levels, or even birth defects. And nowadays, more people are accessing their genetic profiles through DNA testing, but you can also get a pretty good sense of your own risks through your family history. People whose family has a history of heart disease in several generations of their immediate family are at greater risk than those whose family members do not have a history of heart disease. Age also plays a role, so risk increases with age, especially in women over 65 and men over 55. The environment can also influence risk, so depending what's in your surroundings, maybe it's exposure to air pollution or secondhand smoke. And although we can't change these risk factors, we can be more aware of our risks and take preventative action. And here are some of those risk factors that you could take preventative action in. One is high blood pressure or hypertension. This is the most common risk factor, and it actually impacts 75 million people in the US. So specifically, high blood pressure puts extra strain on the blood vessels and extra stress on the cardiovascular system. High blood cholesterol, or more specifically, high levels of LDL or bad cholesterol, or low levels of HDL or good cholesterol, increases your risk. Cholesterol can build up and form plaques in the blood vessel walls, so it can cause blockages or just in general make it harder for the blood to circulate. Although blood pressure and blood cholesterol levels partially are influenced by genetics, we can also influence them by lifestyle, including the following. So one is smoking cigarettes. This greatly increases your risk of heart disease and for those around you, specifically by raising blood pressure and also damaging the blood vessels. Alcohol also increases your risk by increasing blood cholesterol, triglycerides, and blood pressure. Having a sedentary lifestyle. So to have a healthy heart, we have to make sure we're using it, and people who don't use it through exercise tend to have higher rates of heart disease. Diet is also really important, specifically for managing blood pressure and cholesterol and healthy weight, which we'll dive into soon. And stress. So chronic stress can increase blood pressure and can also specifically increase the risk of heart attack or stroke. And diabetes. So having diabetes significantly increases the risk of heart disease, largely due to alterations that happen in the metabolism. So for folks with diabetes, it's not only key to focus on the blood sugar, but also to focus on the preventative aspect of heart health. And finally, dental care. So your oral health has an impact beyond the mouth, including your heart. So keep up on your cleanings and your fillings. Given these risk factors, let's transition now into talking more about what you can do to help reduce your risk of heart disease. First is to be physically active. So it's important to move and put your heart to work so that it can stay strong. Exercise is also important in reducing blood pressure and helping to maintain a healthy weight. The recommendation is that adults get 2 hours and 30 minutes of moderate intensity or 75 minutes of vigorous intensity exercise per week. And if this seems like too much for you, it's okay to start lower. Even just a small amount can help, like gardening or walking or even just taking a stretch break. Do as much as you're able to just get your body moving. And while aerobic exercise is definitely recognized as having a more direct impact on heart health, it's also important to do some sort of strength exercise to get the most benefit. And for nutrition, here's a brief overview of what you can be thinking about. These are just general recommendations, and so if you want more specific guidance, I'd encourage you to reach out for a nutrition consult, and we can go over this in a way that's more specific and applicable to your health. So for one, dietary fat, it's recommended to limit saturated and trans fat. So these types of fats are believed to increase the LDL or bad cholesterol. Some sources of saturated fat include fatty cuts of meat, many processed or fast foods, solid fats like butter, and also tropical oils like palm oil and coconut oil. Trans fat you find from hydrogenated oils, so often these are used in processed foods, and so it's important that you read the label looking for that word hydrogenated. Instead of saturated and trans fats, try to include more unsaturated fats. These are things like olive oil, liquid vegetable oils, nuts, seeds, avocados, whole grains, fish, seafood. A particularly beneficial type of unsaturated fat is omega-3, which appears to be more protective against inflammation and chronic disease. And you can find omega-3s in fish, seafood, flax, or many plant oils and seeds. Fruits and vegetables are also always important, especially for reducing the risk of many chronic diseases like heart disease. And one reason is because they have fiber, which can help reduce the levels of bad cholesterol, but they also have vitamins, minerals, and special plant compounds called phytochemicals, which help to fight inflammation and keep everything working smoothly in the body. Similarly, whole grains are a great source of fiber, vitamins, and minerals, and they can also sometimes provide healthy fats depending if they have added nuts or seeds. Limiting salt is also recommended, specifically for healthy blood pressure. And if you're the type of person who does best when following guidelines or a more specific diet, there are actually quite a few options out there that are well supported by research to be beneficial in preventing heart disease, as well as many other diseases. I'll refer to these as eating patterns rather than traditional diets because they're more about flexibility and taking an overall lifestyle and approach to eating. So these include the Mediterranean diet, which mainly has an emphasis on healthy fats, especially from seafood, and also fruits and veggies. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, and that's aimed specifically at blood pressure, but it's very similar to the Mediterranean diet with an emphasis more on lean meats, whole grains, and fruits and veggies. And then finally, the vegetarian or flexitarian or plant-based diet, which is very popular right now and for good reason. This can range from anything from a vegetarian diet to a simple diet that favors more sources of plant protein and less animal sources, but it doesn't have to be so extreme. If you're interested in learning more about any of these eating patterns or finding ways to incorporate some of these recommendations, I am happy to help. And finally, there are a lot of other general wellness factors to think about. So one is stress management. Since having chronic stress increases your risk, it's important to have a plan in place. And you can also check out our previous webinar on this for more. Similarly, sleep is important to general health and well-being. We also have a webinar on that if you're interested. Smoking cessation is a really key one. If this is an issue for you, you might choose to seek help on this. Alcohol in moderation. So try cutting back on regular alcohol consumption, which means limiting it to 1 drink per woman or 2 drinks per men. And some of you may be thinking, wait, but what about red wine? Yes, there is a fair amount of research that red wine contains plant compounds, those phytochemicals, that appear to be protective. However, it does appear that it just makes it so that the red wine is less damaging than other types of alcohol. So all this to say that if you're gonna drink, you could do so in moderation, whether it's red wine or your other favorite beverage, but drinking red wine in and of itself, you won't necessarily be as protective as if you weren't going to drink alcohol to begin with. Medications, so if you're prescribed any medications for blood pressure, cholesterol, diabetes, anything, it's important to make sure you take them as directed by your doctor. And finally, keep up on your medical visits. So regularly see your doctor to get blood work to know how you're doing, and especially if you notice any of the following symptoms, which could signal some sort of cardiovascular disease or event. And I wanted to end on just a few resources you could check out, one being the Wellspring EAP that you have access to through Community Transit. So they have tons of educational resources through their Cigna Wellness and Medical Topics library, and you can also seek specific support for alcohol and smoking cessation. There's also the American Heart Association and the CDC. Those have great resources as well. And of course, you always have Atlas Wellness as an on-site resource. So again, we do nutrition, fitness, stress, and other wellness areas that might impact your risk of heart disease. And specifically, what I'd like to promote is our new on-site biometric screening. So we can actually take the labs for cholesterol, triglyceride, glucose, and blood pressure on site and give you recommendations right there, individualized to your needs. So I would recommend that you take advantage of this free service. It's super awesome that you have this available to you and that you don't have to go all the way to your doctor or your lab to get this type of information, and that you can get that instant feedback from healthcare professionals. So if you're interested, here's our contact information, and don't hesitate to reach out. Thank you.